Good afternoon, everyone. Thank you so much for joining us. I'm really excited to present another one of our informational webinars for all of our clients and anyone who might be interested in learning more about Medicare. I'm really excited for today's presenter. She's not only kind of the queen of all things Medicare, she's helped out numerous friends and family and some of us here in the office even. She's licensed in California and Washington State. If you have any questions, feel free to ask them away. We'll be monitoring the Q&A. But I'm pleased to present her not only as the queen of all things Medicare, like I said, but again, because she has one of, I think, the best taglines, which I'll let her explain in a little bit here. And she is also a very near and dear friend. I've known her, I think, probably most of my life, and I'm really pleased that she is offered to do this for our clients. So without any further ado, I present Roshanak Kloon.
Turn the camera on. Hi, everybody. I'm Roshanak, like Andrew said, and thank you for having me. I'm so excited to be here. And I love explaining Medicare because it's confusing for everybody, like literally everybody. So, and they change the rules from year to year. So and we have to study up everything and recertify for everything. So I'm really excited to explain the rules and how it works out for everyone. So, and my tagline is don't turn 65 without me. So now if you already did turn 65, I'm still here to help you and answer all your questions. So we can start now. All right, so we're going to go through all the some of the questions about Medicare and what's true and what's not true, because there's a lot of stories always going around Medicare. And like my friend said this, my cousin said that, my sister said that. So these are the most questions asked from me every year about, or from a lot of people about Medicare. So we're going to go through like what's Medicare, who gets Medicare, do I need Medicare if I have a work insurance, and all of these questions. So one by one, we're going to go through them. What's Medicare? So Medicare is insurance. It's a state, federal health insurance that U.S. citizen and legal residents can get. And it's funded by taxes that you pay while you're working. That's why the rules are like you have to have worked so many years, so many quarters, like 10 years, 40 quarters. And it's individual insurance. So it's not for like families or husband and wife. It's everyone has their own plan. Can they get their own plan? And then it's individual. Is Medicare free? Medicare is not free. We pay for the Part A all through the years, and we pay and qualify for Part B, but then Part B also has a premium. And like I said, it's not a family plan, and it's different than Social Security. You don't have to collect Social Security to get your Medicare. You can wait and collect your Social Security later, but then you can still have your Medicare insurance activated. And Medicaid is different than Medicare. Medicaid is a state offered plans for people who can qualify for it financially. And each state is a little bit different, and they have their own rules, and you have to separately apply for it. However, you can have Medicaid and Medicare at the same time. And like I explained, Medicaid, what it is. So it is the state's plan for the people who qualify for because of their income level, and state to state is different. And if you have Medicare and Medicaid together, they call it dual eligible or Medi-Medi. A lot of times you hear people are Medi-Medis, and that's the people who have Medicare and Medigap or Medicaid.
Yeah.
And who can get Medicare? So like I said, you have to be a US citizen or a legal resident. If you're a legal resident, you have to have lived in the United States 5 years in a row, and the 5 years before you turn 65. People who are under 65, if you have been disabled and collect disability for 24 months, and people who have ALS or end-stage renal disease, they also qualify for Medicare. And I think their wait period for them is less than 24 months. And we talked about that too. So can you have Medicare and Medicaid at the same time? And the answer is yes. And sometimes when you do have like Medicare Advantage plans with your Medicaid program, you get a lot of extra benefits than you would get with just having a straight Medicare and Medicaid. Do I need Medicare if I plan to work past 65? So people who have insurance from their employers, whether it's from their own job or their spouse or partner's job, if a company has 20 or more employees, they don't have to apply for Part B. And if the coverage is credible, they don't have to apply for Part B. So you get Part A when you turn 65 automatically. So you get your Part A, but then you can wait till you no longer want to accept the employer's insurance, or you can, when you retire, you can apply for your Part B and get onto the Medicare program. And all of that applies if you're on the health insurance plan with your spouse or partner. But if you can still be working and be on a Medicare program. And this is a thing you have to remember, some employers require you to apply for Part B and pay the premium, because Part B has a premium. We're going to get that, because they use the Medicare for the primary insurance, and then they use their insurance for secondary insurance. But you can have Medicare while you're working. But if you take any part of Medicare, you will no longer be able to contribute to your HSA health savings plan. Medicare will not cover any of your dependents if they were on a plan with you with the employer, and then but some companies let you keep your family on it, and some don't. If you leave, then you have to leave the plan that they offer. You have to take your family off of their plan as well. And that's different from company to company. So you always have to check with the HR to figure out what the benefits are. And now we get to what Medicare covers. Also, I want to tell you that just because a company offers you Medicare health insurance plan, that doesn't mean their plan is necessarily better. So always try to compare the plan that you get from your employer and the plans that are available for you through Medicare, and see which one has the better benefits for you and it comes out cheaper. So when you turn 65, like I said, you already paid for your Part A if you worked 10 years. And so you get the Part A, which pays for hospital and inpatient care, and we can talk about that. However, hospital and inpatient care Part A has a deductible, and the deductible may change from a 1 year to another. So you keep that in mind. Part B, when you're turning 65, you can apply for it 3 months before you turn 65, the month that you turn 65, and the 3 months after you are eligible to apply for Part B, and has a premium. And it pays for doctors and outpatient care, but only 80%. So you're on the hook for 20% with no cap. So these are the benefits that you get when they say Part A pays for hospital. They pay for the room. This is after the deductible. For the room and the meals and the any care that while you're in the hospital, prescriptions that they give you. Although the prescription is a little bit tricky because some of them falls under Part A and some of them doesn't. So it just depends. But yeah, for most of it, they pay for labs and operating room and recovery room services, skilled nursing services, some blood transfusions, hospice care, and part-time skilled care for the people that they're homebound, and rehab, obviously, if you qualify for it. So Part A, you don't have to pay for it because you already paid for it with your taxes all the years that you work. And you can't have denied coverage, and it's nationwide. Anywhere, if you have any issues, your Part A covers you. And the coverage is for each benefit period, which is annually. And you have to be admitted as an inpatient patient. And it gives 60 lifetime reserve days, because you get like 90 days and then you have 60 extra days and you can use them separately. It's not all has to be together. Part B covers the doctor's visits, annual checkups, and clinical lab services, anything that's not in the hospital, x-rays, MRIs, CAT scans, some health programs like smoking or rehab situations, physical therapy, diabetes screening, educations, and certain supplies for diabetes, mental health care, durable medical equipment, which is very important, and ambulatory surgery center services, ambulance and emergency room services. And also Part B has a deductible, but it's lower than Part A, and Center for Medicare changes these deductibles from year to year. So the monthly premiums for Part B depends on your last 2 years of household taxable income. And it has a cap. So like if you make a lot of money, it doesn't keep going up and up. So it has a minimum and a maximum that you pay for that monthly premium. And you can't be denied coverage, and also coverage is nationwide. And if you are eligible for Part B and you don't have a credible insurance, like employer insurance, or a lot of veterans, or things like that, if you don't apply for your Part B, you will have to pay a penalty when you apply for it down the line. It says unless you qualify for a special enrollment period, which means like if you're coming out of your employer insurance, or if you were out overseas and coming back, things like that. But otherwise, you have to pay a penalty. And the things that Part A and Part B don't cover, all of your out-of-pocket costs or prescription drug plan, dental, vision, hearing, glasses, hearing aids, long-term care. Long-term care is different than skilled nursing. Sometimes people get it confused. Skilled nursing is just rehab, like if you had surgery or something. And all the excess charges for services by doctors who don't accept Medicare. So if your doctor is not contracted with Medicare, Medicare doesn't pay for it. And any outside of United States services, they don't pay for that. Where can I get Medicare coverage? So when you get your Part A and Part B, when you get your Part A and sign up for your Part B, to cover all these extra charges, your deductibles, and because like I said, they pay 80%, you're on the hook for 20% without a max. So if you go to visit the doctor's office and your bill is $100, 20% is not so bad. But if you have surgery in it, it's $100,000. So you want to have something to cover that 20%. Plus, you have to have Part D for prescription drug plans. Otherwise, down the line, when you need prescription and you sign up for Part D, then you also have a penalty for that. And penalty for Part B, not having Part B on time, and Part D, once you get the penalty, it's a lifetime thing you have to pay. So to cover all these things, there's two ways you can go. One is called Medicare Supplemental Plans, or called Medigap, which within themselves, they have Plan G, Plan N, different names, and different plans cover different benefits. And then with those plans, supplemental plans don't cover prescription drug plans. So you do supplemental plan and prescription drug plan. That's one option you have. And then another option is Medicare Advantage plan and Part C, or it's called Part C. Medicare Advantage plans are county by county, state by state. So if even you move from one county to another county in the same state, you have to change the Advantage plan. And these Advantage plans combine Part A and B. And most of them include Part D. There are some that they don't, and those are for like people who already get D from other places, like veterans. And they can offer additional benefits like vision, hearing, gym membership. Some give over-the-counter benefits, give you money to buy stuff over the counters, money for glasses, things like that, because the insurance companies can give you extra benefits included with your Part C. But like I said, that just depends what state or what county you are in. So this is what explains what Part C covers. And the way it works is that Center for Medicare turns the account over to the insurance company and they take care of you. And they're all from the insurance companies. And so depending on what group of doctors you go to, you know, what hospitals you want to use, the plans are different from that. And Advantage plans have HMO plans and PPO plans. The difference between Advantage PPO plan and supplemental plan is with supplemental plans of Medigaps that we talked about earlier. You can go to any doctor in the United States that is that accepts Medicare insurance. With the Advantage PPO plans, the doctors are in the network and out of the network. So the plan benefit could be different for the in the network and out of network a little bit. So again, about Part C. Part C covers all of the benefits of Part A, all the benefits of Part B, and most of them, like I said, have drug plans. They give you dental. They don't always necessarily give you dental. There's some have dental plans or limited dental that they give you, but most all of them have vision, hearing, and gym membership, fitness benefits. And also supplementals and advantage plans have to give you anything that Medicare gives you. So you don't ever have to worry about if I sign up for a supplemental plan or advantage plan, then I won't be able to get some of the things that Medicare, the straight Medicare offers. Also, a lot of advantage plans, it doesn't say here, they offer out of United States benefits. So that's another good thing that you can have with if you sign up for Part C. Supplementals have that out of the United States benefits, but not as extensive as advantage plans. And there's all different kinds of advantage plans. These are all like different kind of advantage plans or HMO plans or point of service plans. And then there are PPO plans, there are special needs plans for people who have like Medicare and Medi-Cal or chronic needs, or if they're living in a nursing home, they have special plans for that. So, and private fee for service or medical savings account plans. So advantage plans within themselves have several different types. And so these are the facts about advantage plans. You have to have Part A and Part V, and you can't be denied coverage because of pre-existing or financial situation. You may have to go to a certain providers or pharmacies, and coverage and costs differ from one plan to another. And they all have a maximum out-of-pocket, annual maximum out-of-pocket, which means if your copays reaches that amount, then you don't pay anymore, and the insurance company pays all the rest of your cost. And they may have monthly premiums, may have 0 monthly premiums, but you have to remember you always have to pay your Part B premium, whether you have advantage or supplemental, because if you don't pay your Part B, you lose everything, and then you gain a penalty on top of it when you reapply for it. So that's very important. If you don't collect Social Security check, make sure your Part B premiums are on auto pay. Once you start collecting your Social Security checks, then they automatically deduct it from that. So Part D, which is prescription drug plan, you can sign up for the standalone Part D, or it could be included with your Medicare Advantage plan. Or if you have a employer plan, you should have a credible drug plan with them too. Otherwise, after you get out of that, you have to pay a penalty. So the medications are the types of the drugs that they cover is the most common drugs that people use, and specific brand names drugs and generic drugs are included. And each plan has a formulary. So plan to plan, the formularies may change. They all have to cover basic, all of those type of drugs that we talked about, but the formularies may be different. And they also cover the vaccinations that are not covered by Part B. Some prescriptions are covered under Part B as well. So each formulary has tiers: tier 1, tier 2, tier 3, tier 4. I always tell my clients, rule of thumb is your medications more expensive, probably in a higher tier, and it will be with most insurance plans. But still, if you don't have an Advantage plan and you have a standalone prescription drug plan, you should check your plan every year, because formularies change and drug costs change. So you need to be able to find out which is the best plan for you for the upcoming year. So just because it was best for 2023 doesn't mean it's best for 2024. And when you take the cost, make sure you remember monthly premiums, if there's a deductible, and the copays. Even if you have a Medicare Advantage plan, you pay a copay for your visits for doctor and things, but then the copay for the drugs are different. So this is, oops, this is a little bit confusing for everybody, and they call it like a donut hole, or if you fall in a gap. And the way it works is if what you pay for the co-pays of the medication and what the insurance companies pay, the first part initial coverage is what you pay and what the insurance company pays together. If that comes to $4,660 total, then you fall in a donut hole. Now, that is just for 2023. 2024 is a little prices, amounts are different. But then if your cost alone gets to $7,400, then you come out of the donut hole and you're in a catastrophic part. That for 2023 means that all of a sudden your cost gets a lot lower and the insurance companies gets a lot higher. But when you're in a gap coverage or donut hole, your cost goes up. Like if your copay was like $10, if you fall into the gap, all of a sudden your cost can go up from $10 to like $200. So that's a very confusing thing that happens to people. Some people it doesn't happen through the year, but some people it does happen. So but these amounts are for 2023. For 2024, it's going to be a little different. So you have to be enrolled in Part A and Part B to qualify for prescription drug plan. And you may have to go to a special pharmacy networks. Usually you can go to any pharmacies. Some maybe they're a little bit cheaper if they're in network pharmacy. And coverage and costs is different from plan to plan, like I said before. And Part D premium penalty, if you don't have a Part D when you qualify for Medicare and don't have a credible other insurance, you get that if you don't sign up for that as well. And then Medicare supplementals, like I said, you still have to have Part A and Part B, and can be used, can't be used by, you can't have Medicare Advantage plans and supplemental plans. You can only have one or the other. And then there are 10 plans that are standardized by Center for Medicare. So all the insurance companies offer, not all of them offer all the plans, but so if they offer the Plan G benefit is exactly the same, no matter what insurance company you sign up for. But the prices may be different. So you can always check, and that also depends on your county and state, the prices. So the prices can be different, but the plan benefits are exactly the same. Like Plan G plan benefits are the same, Plan K plan benefits are the same. So be careful and check all the prices to make sure what is different. And these plans are offered by the private insurance companies as well. And so when you have supplemental or Medigap plans, they bill the Medicare first, and they pay their share, and then they bill the insurance companies for the rest of it. So they pay for the deductibles for the Part A and Part B, and or depending on what plans you sign up. Some plans you have to pay the Part B deductible, which is a lot less. And then Part A, so plans may help you pay, like it says, Part A hospital co-insurance, which is a deductible, Part A skilled nursing facility care co-insurance, Part B co-insurance or co-pays, cost of the blood transfusion, because that sometimes you have to pay part of it yourself, costs for 365 extra hospital days, hospice care, Part B deductible, Part A deductible. We don't have a plan that pays for the Part B deductible anymore. They used to be, but now we have to pay that. So that they need to fix that. And then some plans offer the foreign travel emergency. Not all the supplementals plan provide that. So you have to be careful that, you know which plans cover that. Supplemental plans covers what basic Medicare covers. That's why they don't pay for glasses or vision, hearing, long-term care, or prescription drug plan. So if you have a supplemental plan, you also have to have signed up for the prescription drug plan separately. So you have two plans if you sign up for supplemental and prescription drug plan. And Medicare. So you have to carry 3 cards. And so these are some of the supplemental plan benefits. And if you're interested, it will be on your website, and then I can also email you these directly so you can look at it. And I think we talked about all of this. Oh, so when you turn 65 or when you get your Part B, then there's no medical underwriting to sign up for supplemental. You qualify, your guaranteed issue, you qualify for it automatically. But after that, so you can always go from supplemental to Advantage plans. Advantage plans never ask you any health questions. But for supplementals, when you turn 65 or when you qualify for Part B, you can sign up for it. But after that, if you have some issues, you may not be able to switch to supplemental plan. However, there's always some kind of a loop, not always, but sometimes there's loopholes or some guaranteed issues that comes up that you can sign up for that. And any doctor, it says that nationwide coverage and no provider network. There is no network, but the doctors that they accepted have to be contracted with Medicare. And plan premiums may be different with each plan and each state and each company. And plans with more coverage obviously have higher premiums. You always have to pay your Part B. That's the important part. Can't forget that. And how much does Medicare cost? So like we talked about, fixed amount that you pay for coverage is usually monthly. So the deductibles, like Part A has a deductible, Part B has a deductible, and then the fixed amount co-pays are a fixed amount you pay at the time of the service. Co-insurance is the amount. Oops. Oh, I did something wrong here. Okay, there we go. If you say like 80-20, like the insurance company that pays 80, you pay 20. Like Medicare pays 80, you pay 20. That's co-insurance. Okay, and so Part C, D, and Medigap costs. So Medicare Advantage plans are usually way less expensive than supplemental and Part D plans. And some of them have 0 monthly payments. Most of them have 0 deductibles, especially for in-networks. You pay co-pays and co-insurance with the Part C. And Part D, you pay your monthly premium. Some Part Ds have deductibles, some don't, and then you pay the co-pays and co-insurance. Usually it's just a co-pay that you pay. And Medicare supplementals, you pay your monthly premiums. And if there's a deductible, you pay the deductible. And if there's a co-pay, you pay co-pay. There are some supplementals that you don't pay co-pay. You just pay your monthly payments and your Part B deductible, and then you're good to go. And all Medicare Advantage plans have a maximum out-of-pocket, which means, like I said, if your co-pays adds up to a certain amount, you don't pay anymore. The insurance company pays for the rest of it. You always have to pay your Part B though to the Social Security. And how to choose the plan that's best for you. That is so individual. A plan that's best for one person, that doesn't, even in the same household, that doesn't mean it's the best for another person. So Medicare coverage, this is how it works. The original Medicare has Part A and B, and then you have to sign up for Part D, or you sign up for, you have your A and B, and you sign up for Medigap and you Part D. So that's with the original Medicare and Medigap or supplemental. Part C, which is Medicare Advantage plan, includes Part D and A and B. So everything is in one. Most of them have Part D. So they're all in one, but they are in and out of network doctors with Advantage plans. So you have to make sure your doctor is in the network, and or if you're signing up for Advantage PPO plan, also the doctors are in the network, or the co-pays, and if they have deductibles and co-insurance, is something that you can afford and it works for you. Like we talked about that, these are all over your choices. You can have just the original Medicare, but remember that you're on the hook for the 20% with no gap. And also you have to have a Part D, otherwise you get penalized. Or you could choose Part D plus supplemental plan, or Advantage, which includes a lot of times Part D and gives you a lot of extra benefits, but they have doctors in and out of network, and it's less costly. And these are all what the difference between Medigap and Medicare Advantage plans. So which most of the things we talked about. Then Medicare cost of the Advantage plan is a little bit lower, and the Medicare Advantage plan is all in one and gives you extra benefits. And the Medicare supplemental plans basically covers just what basic Medicare covers, no extra stuff, and the cost a little bit more expensive, but you can go to any doctor anywhere in the United States that is contracted with Medicare. And when can I enroll? So for, like I talked to you about, when you're turning 65, 3 months before your month of your birthday, or 3 months after the month of your birthday and the month of your birthday, you can sign up for your Part B. And when you have your Part B, then you can choose whether you want to go supplemental with Part D or Part C Medicare Advantage plans that includes a lot of extra benefits and has Part D usually included. Now, after the 3 months after the month of your birthday, if you don't sign up for Part B and you don't have credible insurance, if you have credible insurance, you don't have to sign up for Part B, then you get penalized. So make sure you remember that. A lot of people get confused and think if they're still having credible insurance, they have to sign up for Part B. No, you don't get penalized for that. So general enrollment period is October 15 through December 7th, and that's for Part C and Part D. Supplemental plans, you can change through the year if you want to change, but you can't change from Advantage to supplemental if you have Part D included with your Advantage, because then you lose your Part D. So you have to be careful about that. And if you did not have your Part D, you get a late enrollment premium penalty, or Part B. And then open enrollment period, that's when you turn 65, when you turn 65, the 6 months that we talked about, plus the 1 month, your month of your birthday. And everything starts the first day of the month of your birthday, not when you turn 65. And when you sign up for supplemental plans, when you qualify for Part B, which is when you turn 65 or you have a special enrollment, you don't have to have any underwriting or any health questions. But then after that, you may have to answer the health questions. And this is the special enrollment period for the people who are past 65. So if you are still working, then you get 2 months to enroll, and when you retire, you get 2 months to enroll in your Part B, and then your Medicare Advantage plan or supplemental plan. And originally you get the 8 months to sign up for Part A and B, but you get your Part A. So Part A, you don't pay any monthly payments, and the penalty is 10% of the Part A premium. So as Part B is at 10% of the Part B premium if you haven't signed up for it, and you have to pay the Part B premiums. And Part D, you pay if you didn't have the Part D after you turn 65 or qualify for Part B, it's 1% of the average price of the drugs or medication in the United States for every month that you did not have Part D, or the same thing with the Part B, and then you have to pay it for the rest of your life. They add it to your premiums. So for the coverage, like I said, October 15th through December 7th, you can change your Part D and Part C. And if you're in supplemental, different states have different rules that you can change your supplemental without no questions asked, or you can just change it if you want to go through underwriting. And if you qualify for it, you can change from one supplemental to the next another company supplemental. And then if you are enrolled in a Advantage plan, one time between January 1st to March 31st, you can change from one Advantage to another Advantage, or from Advantage to supplemental and a drug plan. One time you can do that if you're in Advantage. If you're in a supplemental, you don't get that, a special open enrollment period. And then there's other qualifying period, special enrollment periods too, like if you're moved from one county to another, one state to another, if you left the company insurance, if you retire, you lose, and your COBRA ended, and things like that. Otherwise, you have to stick to the enrollment times that the Medicare Center for Medicare gives you. And so to use your benefits, make sure you do all your preventative cares, use if you have Advantage plan, use your in-network provider, and generic drugs obviously they're a little bit less expensive, so use the generic drugs instead of the non-generic drugs, and use the plan preferred pharmacy. A lot of times the mail order pharmacies are a lot cheaper, and understand where your status of your hospital and how it works. In case of emergency, you are covered anywhere under your Medicare Advantage plan, because that's another thing that people worry about. And you can always ask for extra help in your for your Part D, and for Medicaid, that is strictly by the state by state. So make sure you contact your state, and you can apply for help for that. So, and you can always check Center for Medicare, or check with me or Andrew, and we can always answer all your questions. Thank you.
I'll hop on over here, actually.
Okay.
So thank you all so
Oh,
much.
can they hear you?
No, there was a ton of information. Clearly, we had some technology issues at the last minute, such as the joy of Zoom meetings this day and age. But Roshan, thank you so much for your patience and flexibility and really offering this this information. So many times, Lindsay and I get questions. There's so much information to know, and being able to rely on partners and having opportunities like this for you to come and speak to our clients. And again, I know you've helped members of my own family, who shall remain nameless, but also other clients we refer to you, and some folks here in the office. I know you've always done such good work for them. A huge planning opportunity. Don't turn 65 without Roshanak. So thank you again for all your attention. Thank you, Roshanak, for your flexibility coming in here. We appreciate it. I don't see any questions. I will go ahead and share Roshanak's information so that they can reach out to you. One question that I think I had was, I don't know if you addressed this already, so I apologize. If someone wants to enlist your services, how do they go about paying you?
There's no charge for my services. The insurance companies pay me, and it doesn't matter whether you go through an agent like me or go directly through an insurance companies, your premiums won't change. But if you have a agent that helps you, we can advocate for you, and we can show you all the plans available in your area, so you don't have to call different insurance companies and try to get information from them. We can lay it out for you, answer all the questions, and help you pick the right plan for you. It doesn't matter to me which plan you sign up, as long as it's a right, correct plan for you. So there's no charge for my services. And if you have any questions, please call me. I'm happy to answer your questions. You don't even have to sign up with me. I'm always happy to help out and answer the questions.
Perfect. With that said, Roshanak, again, thank you so much. Thank you all for joining us. Feel free to reach out to me or Lindsay or anyone on the team with any questions. And we will, I guess, not see you next month because we're taking a month off from our webinar events, but we'll see you in November. Take care.
Thank you.